Good afternoon, everyone. This is Cindy Rogers from the Children's Safety Network at Education Development Center. I'm very pleased to welcome you to today's webinar, Playground Safety, Having Fun and Staying Safe. This webinar has been scheduled to highlight Playground Safety Week. Before we get started, my colleague Rebecca Wilmer will provide a few technical announcements. Rebecca?
All right, thank you, Cindy. So there are two options to hear today's audio. You can either listen through your computer speakers or you can call into our phone line at 855-835-7973. If you are participating via phone, please mute your computer speakers to eliminate echo. Phone lines will be muted during the presentation to eliminate background noise. If you have any questions or technical issues at any time, you can type them into that Q&A box on the left. After the presentation, we will pause for the presenters to answer your questions. We also have several resources available for downloading today above the slide deck. To download a resource, you can click on its name and then select the Download Files button to save the document to your computer. There is also a PDF of today's slides in that file pod. This webinar will be recorded and archived and sent out to all registrants after the session. All right, back to you, Cindy.
Thanks, Rebecca. Today we have two presenters with tremendous experience in playground safety. You probably already know that the topic of playground safety is extremely broad and encompasses issues that range from the technical to the philosophical. So I greatly appreciate today's speakers for accepting the challenge of sharing their expertise with us, especially in such a time-limited frame. Following both presentations, we will take time for your questions. Our first speaker is Dr. Heather Olson. Dr. Olson is an associate professor and graduate coordinator in the Leisure, Youth, and Human Service Division within the College of Education at the University of Northern Iowa. In addition, she serves as the Executive Director of the National Program for Playground Safety, which was established in the School of Health, Physical Education, and Leisure Services in 1995. Since its inception, the program has provided contracted services and promoted advocacy for quality, safe, and inclusive play areas for children and youth worldwide. Dr. Olson is involved with the development of children's outdoor play areas and educating the public about maintenance, supervision, and age appropriateness. She has given numerous presentations throughout the country about the design of safe playgrounds and has written many articles on creating playgrounds for children. She has co-authored Safe Play Areas, Creation, Maintenance, and Renovation, and Safe and Fun Playgrounds. Our second speaker is Amy Hill. Amy has been the Associate Director at the Injury Prevention and Research Center at Lurie Children's Hospital of Chicago since 2002. In her work at the center, she has managed a wide variety of pediatric injury prevention educational campaigns and projects. These include a home safety project, a Window Falls prevention media campaign, work with the Illinois Poison Center on unintentional poisonings, and programs in motor vehicle, pedestrian, and bicycle safety. Amy has conducted several research projects on playground safety and served on the first selection committee for Chicago Plays, an initiative to replace all 500 Chicago Park District playgrounds. In her tenure at the center, she has also managed the community builds for 20 playgrounds. Amy holds certifications as a Certified Playground Safety Inspector through the National Recreation and Park Association and is a Certified Child Passenger Safety Technician. Amy is currently a member of the Illinois Child Passenger Safety, Safe Routes to School, and Emergency Medical Services for Children boards. Now I'll pass the microphone to Heather.
Thank you, Cindy. Good afternoon. I want to thank Children's Safety Network for the invitation to speak during this webinar. And a special thank you to each of you for taking the time out of your schedules to focus and discuss the importance of children playing outside at safe, accessible, and quality playgrounds. Before we get started, I want to let you know that this is National Playground Safety Week. To learn more about this week and the Grounded in Play contest we are launching, please visit our website. As we all agree, play is an important part of childhood. However, outdoor play and playgrounds are more important than ever, with an increasing number of children engaging in sedentary indoor activity. The purpose of this webinar is to help you navigate through the many details of creating safe, yet appropriate and fun playgrounds. Today I will share information related to the latest playground injury trends, agencies and organizations who develop playground guidelines and standards, a brief summary of the 20-year message promoting playground safety. I will then highlight the SAFE model in order for groups at the local, state, and national level to discuss future research and action plans. In this section, I will share the scope of playground injuries and the who, what, when, and where. I will then highlight the effect of playground injuries. Before we get started, I have a question for all of you. Please answer the question on the left. Have you ever had an injury, a playground injury that required medical attention? Click yes or no. The second question, do you know a child who has had a playground injury that was severe enough to require medical attention? Click yes or click no. Very interesting. Close to 90% of you know a child, and 35, for those 35%, sorry about your injury, and oh, wow. The most recent data that is available was published in 2009 by the Consumer Product Safety Commission. The data we do have available clearly prove playground injuries remain. Approximately 218,000 children receive emergency care for injuries. Of those injuries, 51% of them happen on public playground equipment, and public has been is categorized in schools, child care programs, and public parks. 19% of the injuries happen on home playground equipment, and 21% are not recorded. Tragically, between 2001 and 2008, there were 40 deaths associated with playground equipment. And unfortunately, I'm aware of 3 deaths that have just happened in 2016. Examining the data, fractures are the most common type of injury. Other common types of injuries are illustrated above. I also want to address data shows injuries to the head and face are more common in children under the age of 5, but fractures or broken bones are more common with children over the age of 5. Climbers and swings remain as common type of equipment children are being injured on. The images in these slides represent 3 different types of climbing equipment. The challenge with the data is we do not know if there is a pattern of the type of climber. They're generally just documented as the child was injured on a climber. We recommend at the local level, if possible, to create injury report forms that specifically indicate the type of climber. Identifying the specific pieces of equipment can pinpoint and help prevent injuries. So we need to have good injury prevention forms. Falls to the surface are the most common cause of injury, followed by gaps and entanglements. And I will discuss more about these types of problems when I address playground maintenance. How do these injuries affect our environment? There are definite social implications regarding the injuries that children sustain on playgrounds. For instance, the injured child will need extra care from adults or from the social institution that may or may not be able to give it. Also, what does a parent or a child care center or a school do with a child who requires extra medical attention because of the injury? The child may lose time from school. The caregiver may lose time from work. In 2012, a California's attorney's blog wrote $1.2 billion in healthcare costs are spent on playground injuries. It was documented a broken arm at the time cost about $70,000. As noted above, playground injuries have political implications at the national, state, and local political systems. For instance, at the state level, some states have passed laws that indicate playground equipment must be compliant to the Consumer Product Safety Commission, but other states have not. Hopefully, through education and action, we can address the political and economic concerns. Recommendations for playground injury prevention begin with being aware of those key influential groups, whether it be at the state level, the local level, the home provider. Knowing who the players are will help educate and hopefully help prevent injuries. There are many agencies that have been influential in the safety of children's playgrounds. Today, I'm going to address 4 of the agencies. First, the Consumer Product Safety Commission are recognized as the standard of care. Some states, as I just mentioned, some states have adopted these standards. These guidelines can and have been challenged in courts where they have not been adopted into laws. The guidelines, it's interesting because these guidelines were first published in 1981. They have gone through 5 revisions since then, and the latest edition is seen above. It's a purple cover, and it was printed in 2011. Please also note, many of you in the audience today probably work with home programs. The Consumer Product Safety Commission has an outdoor home playground safety handbook as well. Both of these are free downloads on the Consumer Product Safety Commission website. The second influential group is the American Society for Testing Material. ASTM, and these, let me back up, these American Society for Testing Materials are standards for companies who manufacture the playground product. So ASTM publishes safety standards for many kinds of products. Highlighted in this slide are a few of the standards that you may want to be aware of. So when you're purchasing public playground equipment, you want to make sure that the equipment and every piece of playground equipment on that equipment complies with ASTM 1487. And the manufacturer should be able to easily get you that documentation for your files. The third agency is the American with Disabilities Act. ADA became mandatory regulations in 2013 by the federal government. And the regulations are called the 2010 ADA Standards for Accessible Design. The document, you can find the document online, and it provides technical provisions for ground level and elevated play components, accessible routes, transfer systems, ground surfaces, and soft-contained play structures. The fourth agency is the National Program for Playground Safety. We were established in 1995, as Cindy said in the beginning of the webinar, to raise awareness for the need for playground safety and injury prevention. Today, we are not funded by CDC. However, NPPS continues to promote and advocate for safe, inclusive, and high-quality play areas for children. With a small staff, we do our best to educate and advocate. We are open to discussions for partnerships, for action, and research projects related to playground safety. Here's what NPPS knows, and this is what we believe. Children love to spend time outdoors. And unfortunately, a tremendous amount of research shows children do not get enough time to play outdoors. As playground advocates, we have a responsibility to provide children safe and quality experiences outdoors. So let's look at injury prevention, playground prevention at the local, state, and national level. NPPS believes playground injuries can be prevented using the SAFE model. The SAFE model identifies 4 elements of risk that interact with one another to create a safe play environment. For instance, when a child falls from a piece of playground equipment onto the surface, the injury report will probably state that the cause of injury was the child hitting the surface. Although the surface may get the blame, this may or may not be the real reason why the incident occurred. Instead, the cause of the injury might be that the child was too young to play on the equipment, or the equipment was broken and not maintained and the child fell from the broken equipment. Or maybe there was a lack of insufficient supervision. Using the risk factor model, NPPS conducted 2 national studies with funding from the Centers for Disease Control and Injury Prevention in 1999 and 2004. If you have interest, we went to every single state. We visited schools, childcare, and parks. You can find the report card on the NPPS website. In addition, you can download the Playground Safety Checklist. It's a really nice, user-friendly baseline checklist to get started at looking at the safety of playgrounds. The next poll question I'm going to ask you is, how many of you have ever received any type of playground supervision training? This has been a personal passion of mine, and so I don't want to outdate myself here, but about 16 years ago, I did a study in the state of Iowa, and at the time, only 20%, it was 19.8% of elementary school principals were doing any kind of training with, whether it be the teachers or paras when they were outside on the playground. They assumed people had training on how to supervise a playground, which supervising a playground, we have learned, is very different than instructing in the classroom or leading projects and curriculum. So it's interesting to look at the percentage of people just attending this webinar who have and who have not. So let's take a brief look at each one of these elements, starting with supervision. There has been documentation that a lack of adequate supervision was involved in approximately 40% of the injuries sustained by children in playground safety. However, I will also share many expert witnesses that I know and that I talked to today have shared supervision is addressed in nearly every case with playgrounds. So supervision is more than just adults being present. Adults should be trained, especially if they're working in a public setting where they have a duty to supervise children. So we have created a supervision training model, and adults, and the model is talking about what is good supervision. Adults must anticipate potential dangers and problems, not interfering with play, but just making sure the environment is safe. Children and adults must use good behavior when at the playground. And then context is, every playground is unique and every environment is unique. Therefore, adults must understand the playground context. Context refers to supervisors' responsibilities, handling emergency situations, stopping unsafe actions, and stopping or interfering with unsafe behaviors. NPPS has found supervision education, awareness, and training makes a difference in injury prevention. And it also gives the confidence level with the playground supervisor. We have a supervision kit was created to help educate others, and you can find this information on our website. The second crucial factor on playgrounds is the design of the play environment and the playground equipment. Age-appropriate equipment plays a crucial role in not only the child's play experience, but to keep the youngest children safe. Using the CPSC data of those 200,000 plus injuries, 30% of the playground injuries were of children under the age of 5. The literature addresses the importance of outdoor play environments need to be planned with an understanding of age appropriateness of equipment. When it comes to playground equipment, one size does not fit all the needs of children. Rather, the environment, the equipment, and materials should match the developmental skills and abilities of all children. The Consumer Product Safety Commission and the American Society for Testing Material, their standards and regulations say that playground equipment should be separated for children 6 months to 23 months, which ASTM has technical standards for that age, 2 to 5 years of age, and 5 to 12 years of age. As I previously stated, planning is critical because preparation can reduce injuries and save money. NPPS offers professional development training and resources on appropriate developmental design. I also share some other resources NPPS has available that may help guide conversation in your local area. The third crucial factor on playgrounds is fall surfacing. Falls to the surface are the leading cause of playground injuries, making up 70% of reported incidents. Research shows, and there is quite a bit of research out there, shows equipment over 8 feet has close to 3 times the injury rate of equipment under that height. It is also important to note CPSC and ASTM issued a warning on the playground installation and maintenance over hard surface. And as you will see, this is what is stated in both of those documents. In addition, I have added two photos here. Both of these photos, the structure, both of them have been recalled. So on the left are the animal swings, and they were recalled in 1995. And on the right are actually monkey bars. So let's not try to confuse monkey bars with horizontal ladders. And going back to what I stated a few minutes ago, it's very important to identify the actual type of climber that is happening. So both of these pieces have been recalled, and I would encourage, if you know where these are located, to get them out of those in playground environments, because they have resulted in deaths on a number of occasions. Using the fall surfacing research, NPPS developed an education surfacing model to help local, state, and national groups on how to determine if a surface is safe or not safe. And we have a brochure that's very inexpensive. I think it's a couple bucks. If you want to use it. I know it's been used, and people have said it's a really great resource for you. The last critical factor, the fourth is equipment and environment maintenance. So if you remember SAFE, this is E for equipment and environment maintenance. One recommendation to protect children is to develop a maintenance policy for all children's play areas. Next, I will share common equipment concerns that can cause injury. A head entrapment, this is a photo of, it used to be a head entrapment where the bar of the playground equipment to the platform, it was about 10 inches. A head entrapment exists if a space in equipment is greater than 3.5 inches and less than 9 inches. In this situation, the school district took a chain and wrapped it up in some duct tape to stop the problem. But what really needs to happen is contact the manufacturer, the person who installed it, and get it installed correctly. And this should be done immediately, because head entrapments are life-threatening. Broken, cracked, or loose equipment, whether the loose equipment be metal, plastic, or wood, can cut or puncture a child's skin if not maintained. I have a little white note in here, educate parents on hot surfaces. There has been an increasing number of burns in the last few years on playground injuries, and we need to remind parents, constantly remind parents, caregivers, families, teachers, advocates, to touch the surface to make sure that it's not too hot. Crush and shearing points are another hazard that happens repeatedly on playgrounds. Equipment should not cut or puncture a child's skin. So places to look: moving parts, loose parts, riding toys, getting underneath the equipment to make sure there's no sharp or points where they can shear the child's skin. This is a picture of a swing structure, and as you can see, the S-hooks are open. S-hooks can cause entanglement and impalement. S-hooks should be completely closed so a dime cannot pass through that opening. So where that S-hook at, and obviously here in this situation, a dime could be inserted and that could entangle a drawstring. And this is written in the CPSC handbook. Cables, wires, ropes, flexible parts should not be able to be looped back on themselves. And as you can see, this is a makeup tire swing where it could be a strangulation hazard. Loose ropes should be fastened on both ends. It is instrumental. Safe environments should be meaningful and planned to allow children to have fun experiences at playgrounds. According to CPSC, records of all maintenance, inspections, and repairs should be retained, including the manufacturer's maintenance instructions and any checklist used. Several resources are included at the end of this presentation for free download. Another idea is to prevent playground injuries is to involve the children. NPPS developed a Kid Checker activity that encourages children to help with safety of environments. You can find this on the NPPS website. Equipment and environment continual maintenance is an investment to children and their environments. In order to protect the investment of children, maintenance is key. NPPS has a comprehensive maintenance training program and resources for school-age and early childhood environments. The manual shown are tools to help keep environments safe. Other information about how to do this you can find on our website or give us a call. To recap, I hope you will join us in educating children, families, and local programs who serve children. Also, please encourage everyone to check to ensure environments are safe. I encourage you to continue the conversation on playground safety at the local, state, and national level. Please remember to use the resources that are available at the end of this webinar. Thank you again for helping make playgrounds safe, enjoyable. And remember to check out the Grounded in Play video contest that we're launching for National Playground Safety Week. At this time, I will turn it over to Amy.
Thank you, Heather, and thank you so much for the opportunity to speak as well today. I'm going to talk about the Safe at Play program that we run at Lurie Children's Hospital's Injury Prevention and Research Center. So I wanted to start by answering the question, why is a children's hospital interested in playgrounds? And Heather did a very good job explaining what the injury burden actually is for playgrounds, and it's a large one. So we're interested in preventing playground injuries to kids. And one of the reasons we actually got interested in playgrounds in general is that we are part of the Injury Free Coalition for Kids. Lurie Children's has been a member of the Injury Free Coalition for Kids for more than 20 years. IFCK is a national hospital-based hospital-based community-oriented program that was started at Harlem Hospital by Dr. Barbara Barlow, who is a pediatric trauma surgeon. All of our sites are led by physicians, and all of the mission throughout the country is to prevent injury to children. So here's our model. We look at some kind of community concern and injury concern. We build a coalition around it, and then we work to change the physical and social environment around the injury problem. We develop programs related to the injury problem, and then we evaluate the program and look at the outcome data. So all of our efforts are anchored in research, environmental change, and then starting with the concern the community has at the beginning and data. Here is the Harlem Hospital program. Dr. Barlow is pictured with some kids on the right. And you can see that Harlem Hospital, the yellow and green dots, their injury prevention program was the model for all of our other injury prevention programs. You can see that the green and yellow dots are all playground-related problems or programs. So Harlem Hospital was really interested in working to improve the playgrounds in Harlem as part of trying to make the injury burden less in the Harlem neighborhood. So this is what they actually started with at Harlem. What they were let me get the pointer here. Well, I cannot get the pointer to work. So I want you just to look, oh, there it is, at these were actually the fences that surrounded playgrounds at Harlem at the time that the Harlem Hospital Injury Prevention Program started. And what was happening is the playgrounds were being locked very early or sometimes locked all day, and kids, if they see a playground, they're going to want to get in. And what was happening to the kids is, I've got the arrow right here on it, they were actually getting impaled on the spikes of the fences that were surrounding the playgrounds in Harlem. So that was the fences themselves were actually causing an injury, and they would get into the playground, and this is what they would find, a playground in complete disrepair that with concrete surfacing that we can see here on the bottom, and equipment that was not fit for any child to play on. And Dr. Barlow got very tired of kids coming into the emergency room, and she was basically patching them up only to send them out into this very unsafe environment for them to get injured all over again. So they began to try to make changes in Harlem of the playgrounds, and they got a coalition together that inspected and photographed and graded the playgrounds by CPSC standards. They sent those reports to parks and recreation officials, and the reports really spurred the Department of Parks and Recreation to replace the outdated and unsafe equipment in all the public parks in Harlem. They replaced the surfacing, which was cement and asphalt, and they really began to build new playgrounds for the community schools, daycare centers, and public parks with a combination of public and private funds. And the playgrounds were also a great alternative to kids actually getting injured by playing on the streets. Here's a picture of some happy kids, Harlem residents, playing at a playground that was built by the Harlem Hospital Injury Prevention Program. So I just spoke 2 slides ago about kids playing on playgrounds, and one of the reasons they wanted to build playgrounds is because in Harlem, traffic injuries were actually a leading cause of severe injury, second only to falls. And when they started doing their injury prevention interventions, that included renovating the playgrounds, doing some safety street programs, an urban bicycle program. They saw that actually the pedestrian injury rates declined by 45%. So as they were doing, looking at the epidemiologic data, they came to the conclusion that creating safe and accessible play areas really is an effective way of preventing traffic injuries to children in urban communities. Another reason that we as a children's hospital is concerned about playground safety is we're just concerned about the overall health of kids. We look at the overall wellness when we look at obesity, healthy BMIs, especially in dense urban environments like Chicago, and we know that playgrounds can play an important role in supporting physical activity. We also know that the quality and accessibility of playgrounds really influence their safety and use, and that better outcomes for injury happen when playgrounds are accessible and well-maintained. So we have 2 components of our Safe at Play program here at Lurie Children's, and they include playground surveys and inspections and playground builds. So I'm going to start by talking about our playground survey project. When we started our survey project, in 2005, the state of the Chicago Park District playgrounds was not great. Many of the playgrounds, they have 500 plus playgrounds in their system, was more than 20 years old. They had a big, during the mid-1980s, they actually renovated almost all of their playgrounds. And so by the mid-2000s, they were not in very good shape. They also had taken wood chip surfacing, which Heather talked about earlier, not being something that the CPSC or ASTM guidelines recommend. They put wood chip surfacing directly over the cement or asphalt surfacing that existed prior. And they also lacked a lot of funding for maintenance workers. So the Park District was divided, and still is, into 3 regions. And they typically had one maintenance crew responsible for each region. So that would be one crew of maybe 2 or 3 riggers, which is the union that works on playground maintenance in Chicago. And they were meant to do 135 or so, maintain 135 playgrounds, which is a lot of work for a small crew of riggers. They also had a really complicated funding structure for communities that wanted a newer replacement playground. They subscribed to this third formula, which meant a third of the money for a new playground needed to come from the Park District, and a third of the money needed to come from an elected official, typically the alderman, who would be the local city elected official in the neighborhood. And then a third needed to be raised by the community. And at the time, in 2005, a new playground was costing about $400,000. And so that meant that the community would be responsible for raising over $100,000 of money, which would be a lot of money for a community that of a lower socioeconomic level to raise on its own. It's a very steep curve of money to raise, and we began to get a little bit concerned that playgrounds are only going to be then replaced in areas where there was more affluence. So we began working with the community liaison at the Chicago Park District to actually perform a playground, go out and perform a playground inspection when a community was concerned about the safety, as kind of part of building the case to the Park District for a new playground in that area. And as we were looking at playgrounds, we really began to realize that we wanted to look at more than just whatever the community was saying needed to, that where they wanted a new playground, that we wanted to look at the playgrounds in general. And so we got permission from the Chicago Park District to work on a citywide survey of all of the playgrounds. We partnered with an advocacy group called Friends of the Parks, and most importantly, we got funding from Kohl's Cares. And we still do have funding from Kohl's Cares for our playground project. And we began surveying the Chicago Park District playgrounds in 2005. We used a tool that Heather showed earlier, developed by the National Program for Playground Safety, the Safety Report Card, but we did have to change it slightly based on some safety concerns that we found existing a lot in Chicago. In some years, we've surveyed all the playgrounds. Some years we've looked at the failing playgrounds from the prior year and resurveyed them. And last year we actually looked at the oldest of the new playgrounds that have been built recently. So we've changed it a little bit from year to year based on funding and staff availability. So here's the state of Chicago Park District parks in 2005. Here we've got on the left, we have a missing protective barrier on the equipment. On the right, we have a slide that's very jaggedy at the edge where kids would be coming off. So the playgrounds really were not in great shape. We've got broken equipment here, broken plastic. We have it's a little difficult to tell in this slide, but we have leaning equipment. This particular playground was actually built over the foundation of a building and wasn't put in properly, so it was beginning to lean, but kids were still playing on it anyways. You can see by all the footprints in the bottom. And then this leads me to the dreaded orange slide that existed on about 200 of the 500 playgrounds. It was installed in a way that it needed much more maintenance than it was getting, and the slide was starting to lean and causing all the wood decks around it to shake, which was not was just problematic, and we really wanted to see this orange slide go away and be replaced. So what were we looking for in the survey? Well, we were looking for all the things Heather spoke about except supervision, which we really didn't have a way of going in and judging just with a snapshot sort of survey. So we looked at the age appropriateness of the equipment, appropriate surfacing, so the depth of the wood chips or the condition of the rubber, and then we looked for equipment condition and maintenance issues. And one of the things that we really found to exist quite frequently on Chicago playgrounds were the stability of the equipment, where the equipment if it was wooden, it was rotting at the base and causing the equipment to shake when kids were playing on it, and then just rotting wood in general and rotting decks. So here's a snapshot of our playground safety report card. We always, when we collected data, we always included the region, as that was a good way for us to tell sort of the condition of playgrounds in different neighborhoods of the city. And then we also put in GPS coordinates, and I'll talk about why we did this later because we did some GIS mapping of this project. These are simple yes or no answers, space for comments on the right, and then anything that's shaded, when we went in, we double counted it when we were counting for percentages because of the potential for a life-threatening injury to occur if one of these conditions existed on the playgrounds. We did the data collection in summer months, and we used a collection of Android phones and paper and pencil, and we've gone back to paper and pencil because in a lot of neighborhoods in Chicago, it's still difficult to get into an online survey through Wi-Fi at playgrounds. Each playground received a score based on the number of yes or no answers on the sheet, and a 70% or higher was considered a passing score, and 69% or lower a failing score. Here's some of the issues we found. Head entrapments, which Heather talked about, rotting wood, and some of the wood was severely rotted in many situations. And this is an issue. Could I get the arrow? I'm having a hard time. Oh, here we go. Right here is where, in a lot of playgrounds in Chicago, they just place the wood chips directly over the concrete. And so at almost all the slides and the swings, we would find as the wood chips were kicked out and not probably replaced often enough that there would be all sorts of patches throughout the playground with concrete showing through. We saw lots of missing barriers and things. So we found equipment in a pretty rough state. So highlights of our results. In 2009, there was a 72% mean score, which went up to 73% in 2010. And then finally in 2015, we surveyed the first round of Chicago Plays, which I'll talk about in a second, renovated playgrounds, and every single one of them passed. In a typical year when we first started doing the survey, roughly 35 to 40% of playgrounds failed each year in the Park District system. We collected this data with the idea that we were going to publish a study about it, and in February of 2013, we did in fact get a study published, and we examined the results with in-depth statistical analysis. And some findings that we came up with were that playgrounds were more likely to fail because of problems with fall surfacing and equipment maintenance. In neighborhoods with a higher percentage of kids, especially minority kids, and a higher percentage of people living in poverty actually had fewer playgrounds and more failing playgrounds. So the GIS analyses that we did were actually pretty interesting. And I want to just go through these real quick with you because it looks like just a lot of dots on a map. This is a map of Chicago in all of the census community areas. And so this particular map is actually looking at just the population of kids. So how many kids are in each neighborhood? So the darker the color, the more the kids are in the neighborhood. And you can see down here in the neighborhoods of Riverdale and South Deering, they actually are pretty dark blue, so they've got a lot of kids, but they actually don't have very many playgrounds. In fact, South Deering doesn't have any playgrounds at all. And then up here, where we have much lighter colors and less kids, we've got more playgrounds. Also here on the southwest side of the city, we have a lot of blue, but not very many dots at all, so there's really not very many playgrounds. This is actually a map of kids living below the poverty line. And so here, the darker the blue, the more poverty existing in the neighborhood. And you can see here, this is the south side of Chicago. There's an awful lot of red. So that means there's a lot of failing playgrounds with kids living below the poverty line. And also here, kind of on the west side of the city, there's a lot of red as well. And up here in the far north side of the city, there's also higher poverty rates and more red. The next map shows just what a segregated city Chicago is. This is the African American population. So the darker the blue color, the higher percentage of African Americans living in the neighborhood. And you can see here on the south side, it's all this dark blue and an awful lot of red, as well as here on the west side. So we've got a lot of failing playgrounds in our African American neighborhoods. And this is actually the Latino population. And what this actually indicated to us much more is that here, this part of the city actually has very large Latino population. And you can see there's a lot less dots than there are anywhere else. And they really, those communities really suffer from a lack of playground and park space for the kids. And so we're collecting this data every year, giving information to the Chicago Park District. And then finally, in 2013, Mayor Rahm Emanuel launched an initiative to renovate 300 aging playgrounds throughout the city. It's a 5-year project, so they're in the midst of the project. And they went from renovating 15 playgrounds and having the community get a lot of financial buy-in to 60 playgrounds where the community doesn't have to raise the money. And they actually used our survey scores as part of their decision-making for the initial decisions on what communities would get playgrounds in the first round in 2013. And all of those playgrounds that we surveyed last summer were still in great shape and all passed. We've also made other progress with the Park District. We've been responding to immediate requests for maintenance from surveyors. We also did a playground maintenance, 2-day playground maintenance training for the riggers in spring of 2012. In addition to the playground survey project, I also just perform certified playground safety inspections, mostly for child care centers because they need it for their NAEYC accreditation. And I get to do about 30 playgrounds per year inspected with a written report. We also do playground builds. We've completed 20 built since 2002. We've done them in really diverse neighborhoods and sites at child care centers and Chicago Park District sites. And we feel that we've developed a really terrific hybrid community build process where we facilitate community and organizational buy-in, but we make sure a professional crew does all the post and concrete footing settings and site prep to kind of minimize any issues with things being plumb and level with a professional crew doing it, and then the community build happens in one day and we kind of put the finishing touches on the playground. Here's a nice picture of a before and after of a playground that we built several years ago now. And here's another playground that we did and the sweet thank you card that they made. So I wanted to actually thank you all for calling into the webinar, and we look forward to taking your questions.
Thank you so much, Heather and Amy, for sharing both the national and the local perspectives, your injury data, useful resources, and your guidance for keeping children safe on playgrounds. It's now time to open the floor for questions. If you have a question for either of our presenters, you can just go ahead and type it into the box at the bottom left of your screen, and I will read the questions as they come in. So let's go ahead and get started with some questions. Right. So first question from one of our participants, and you may have answered this, but it's worth repeating. She would like to know how an educator can become certified for playground safety. Heather or Amy?
I can address this. This is Heather. There are a couple different certifications that you can get depending on what setting you're in. The National Recreation and Parks Association has the CPSI, it's Certified Playground Safety Inspector course, and my experience going through it, looking at the curriculum, it's a very technical course when you're looking at the nuts and the bolts and the dimensions of the actual structure of the equipment. So a lot of people in Park and Recreation go through that certification and that training. They also now have developed that course online as well. The National Program for Playground Safety, who I am with, we have actually three certification courses that are run online. One is the Early Childhood Outdoor Play Inspector, and we have looked at every single state child care licensing regulation. We have looked at the National Health and Safety Performance Standards, the National Head Start, NACE. So for those of you in early childhood, you know the language here. We have taken all of those standards, and many of them are similar, very similar. Some are law standards for regulation, and that's how we've developed the Early Childhood Outdoor Play Inspector course, because we are looking at dramatic play parts, loose parts, toys. That course is online, and it comes with curriculum material specifically for the early childhood field. We also then have a school age and community park inspection course that you can go through, looking at school facilities and school grounds, soccer fields, kickball courts, hard surface court, asphalt, turf, whatnot. So that's another inspection course you can go through. And then we have a certified supervisor online training course as well. So hopefully that answers the question. If you have more, you can put it in a Q&A related to that.
Great. Thank you, Heather. Another question is regarding playground inspections, and the participant wants to know how she can determine if there is an agency that's responsible for playground inspections in her state. Can either of you respond to that?
I mean, typically it's not an agency at the state level. It's usually more, Heather, I don't know, are you agreeing with me on this? It's usually a local thing. So whatever agency that actually owns the playground is usually the agency that's responsible for performing the inspection on it or getting someone in to do the inspection.
Correct. There's two other thoughts to this. One is the insurance agent. Some states, depending on what municipality or what school or child care center you are and what insurance you have, certain states require that inspections done on a playground, okay? So that just depends on your insurance holder and the policy that they have. And the other thing to be aware of is that there are states that have adopted the Consumer Product Safety Commission. And if you go to our website, you can find a listing of what we know for states. Some state child care, like Department of Health and Human Services, child care licensing, have adopted the Consumer Product Safety Commission as well. So if it's a state requirement within, whether it's child care or just at the state level, there is more teeth because it becomes policy.
Great, thank you. We have quite a few questions, so we'll try to get to as many as possible. One participant asked specifically, can Heather give us more detailed information about how to access the courses that you mentioned?
Thank you, and I could go on, but I don't want to take all the time. If you go to playgroundsafety.org, right on the front page, it says training. And then if you have further questions about this for one-on-one, if you have a group that wants to take it, we can facilitate a group, but we have training about once a month, every 6 weeks, unless you have a group that you want to go through. Our 800 number is 800-554-PLAY.
Great, that's great. Thank you. Next question is, can you speak about the CPSC playground guidelines being adopted into law by some states? I think you mentioned that there were some challenges in states that have not adopted them. Do you know if the majority of states have adopted them into law?
Oh, this is a really great question, and I wish I would have done my homework a little better to get grounded in what's really current. I will tell you that it takes a local champion to get it adopted at the state level. I know we have this on our website. I'm digging through it right now. If you go into playgroundsafety.org under standards, you'll see the state regulations, but some states have completely adopted CPSC and other states have adopted only part of it. So really quickly, Arkansas, California, Connecticut, Florida, Illinois, Michigan, New Jersey, North Carolina, Oklahoma, Oregon, Rhode Island, Tennessee, Texas, Utah, Virginia, and Wyoming. And this summer, I'm hoping to have one of our graduate students dig back into this because we haven't done this for a few years, but I'm trying to protect some time for us to do that. So if you have a state and you know what's going on in your state with this, I would love to talk to you so we can get our information updated on our website. But we've done the best we can with the little the actual no resources that we've had to do this for you, and it is posted on our website again. So hopefully that answered the question.
Absolutely. That's a great resource. Thank you, Heather. And here's another question. And Amy, I don't know if you have some thoughts about this. One of the participants would like to know if you have information on resources for funding new playground projects. Where would you start with that?
That's a question that comes up a lot. One organization to try is Kaboom. And I think they're just kaboom.org. And they will set, if they kind of actually partner businesses that are looking to fund playgrounds and actually have kind of a volunteer day out building the playground with communities looking for playgrounds. And so that's a good place to try. It's not been easy in the last 8 or 9 years to get playgrounds funded actually. So we get our funding from Kohl's typically, but they fund just our hospital injury prevention program and playgrounds through that. So it's not an easy thing, especially with all the state and local government cutbacks. So
one of the recommendations. This is Heather. One of the recommendations to this, if you're in a school or a child care program or a more formal setting, there is what I'm hearing from people is that if you talk about the outdoor playground, the playground as an outdoor learning environment, because if you believe children learn through play, which I wholeheartedly do, and I had a slide that talked about the physical, the social, emotional, the intellectual development of outdoor play spaces, people buy into that and they understand it when you have the right pitch. So instead of just putting up a playground, it becomes a holistic learning experience for the child in the community because there's so many benefits to having these outdoor play spaces and having a plan and taking, I'm on the phone a lot talking with people in our agency as, we recommend 12 months, if not 18 months to really go through a true planning process, not just out for we're going to buy this equipment on page 32, but really.
No, absolutely, yeah.
So, it's really a planning, and I kind of touched upon that in the presentation a little bit, but planning is key, and not only for injury prevention, but it's also key for funding. It's also key for the child's experience and the family's experience, and for the community benefits. So, start now and begin the conversation because it will take you a year to 18 months before you are ready for a true plan of what you're going to do, and then phase it out. Phase 1 of the space, phase 2 of the space, and it becomes a five-year project, and you really get an environment that is worth of quality.
Great. Thank you very much. I think we only have time for one more question, unfortunately, and the question is regarding teaching materials for teaching playground safety to summer campers. Since summer's coming up, this is particularly relevant.
That's probably more of a question for you, Heather, I think, no?
Yeah, thank you. I'm going to tell you, let me just say what's common sense for one person is not common sense for another person.
Very true.
I've been doing this a long time, and we can't assume, and there's different generations that are out. There may be a person that's, in their 60s out with the summer program, and then you may have a 19-year-old depending on what camp you're at. I will tell you, oftentimes we forget about that unstructured playground time, and we just assume everybody's on the same page, and they're not. And no matter what setting I'm in, whether it's a camp, whether it's a summer program, and when they take kids out to the playground, if you want to call it, there is not consistency. And I believe our supervision training kit is a very user-friendly. It's inexpensive. There is a video, I always like showing the video and then talking about the video and just letting the conversation happen. And then the manual guides you through of types of questions to ask the people you're training. So that's one, the supervision kit. I would also encourage to take our online supervision, the certified supervisor course, or we have a 1-hour baseline information on supervision. But I will tell you, research shows supervision makes a difference.
Great. Thank you both. Unfortunately, we are out of time, but I think that for your remaining questions and things that will come up later, if you check out the resources that were described in the webinar today and the resources that are in the file pod above, I think you'll be able to answer a lot of your questions. And I know that the program for playground safety website is just full of resources. So I want to thank our presenters, Dr. Heather Olson and Amy Hill, for their informative presentations. The next CSN webinar is scheduled for May 25th on the topic of preventing child abuse and neglect. And you can register now for that webinar. Finally, we do have a quick evaluation of today's session, and I hope that you'll take a moment to complete this. So thank you to our speakers and to all of you, our participants, for joining us today.
Thank you.
Thank you all. Take care.